Well, I said earlier that I'm thrilled to be here, and really that's for two reasons. As president of the National Organization for Women, I intend to roll out a national action campaign for single-payer health care. And I am going to want to work with you. And the other reason that I'm here is I really need your help today, this week, next week, for the next month. I really need your help. I want to talk about that in just a moment, but first let me talk about why single-payer health care makes sense for women. Two primary reasons. First, our healthcare system today is employment-based, right? And that systematically discriminates against women, right? Women are overrepresented in part-time work, which doesn't have employer-provided health care. And we are overrepresented in non-union work. And we are overrepresented in minimum wage jobs. All of these jobs, the employer doesn't provide health care. So as long as we have a system that is centered around employment, women will be badly served by it. Medicare for all, single-payer health care would solve the problem. Okay. The second way in which women are discriminated against under the current system is that insurance companies across the entire country are allowed to charge up to 50% more for premiums to women than what's charged to men. It's called gender rating. It's gender rating, and the reason that the insurance companies give for their gender rating is that, well, women's health care is more expensive because women have pregnancy and child care. Right? So first of all, note that any woman, even if she never becomes pregnant and never has a child, is still subject to gender rating and is still going to be paying more. That's number one. But number two, the very people who are overcharging us for their health insurance then undercover us when we actually get health insurance coverage, right? The pre-existing condition. Having had a C-section is a pre-existing condition. And women who have the one C-section can be told by their insurers, no, this next pregnancy is not covered. No, this next pregnancy is not covered. And women are 2 to 3 times more likely to die from complications of pregnancy and childbirth if they don't have prenatal care. Okay. Infants are 6 times more likely to die in infancy if their moms don't have prenatal care. Okay. But that prior C-section is a pre-existing condition. If we had Medicare for all that covered the full range of women's reproductive health care needs, obviously this would fix the problem. But this is where I really need your help. And it comes to coverage for women's reproductive health care needs. Raise your hand, I don't know, maybe raise your hand if you're not familiar with the name Stupak. So last Saturday, the United States House of Representatives passed a health care bill for half the population. Okay? And they passed an anti-abortion measure for the rest of us. Okay? And by the way, it was the rest of us that got these people elected in 2008. So what kind of sense does that make? We were not that happy with the House bill that we understood was going to be going to the floor in the first place at now. It was a weak bill. It did not have a strong enough public option, right? It permits insurance companies to age rate. They took the gender rating out, and believe it or not, this is the deal that they cut. Because we're going to lose profits from gender rating, y'all going to take gender rating away from us, we want to be able to age rate. So now under the health bill, insurance companies can charge twice as much for premiums for people aged 40 to 64 as they do for others. After 64, you go on Medicare, right? So you get, by the way, in the Senate Finance Committee bill, it's 4 or 5 times. The gender rating is 4 to 5 times. So we didn't like that. We also did not like the fact that in the bill that was going to the House floor, it contained a codification of the Hyde Amendment. And you all are familiar with the Hyde Amendment, right? This is the amendment that is well documented to result in the deaths of women. Rosie Jimenez, a 27-year-old mother of a 5-year-old child, back in 1977, shortly after the Hyde Amendment went into effect. She's living in Texas, she was on Medicaid, and because the Hyde Amendment prohibits Medicaid dollars from being used to terminate pregnancy, Rosie drove into Mexico, had an illegal abortion, eventually died of blood poisoning. That's a direct result of the Hyde Amendment. You know, if I could just for a moment, when I was 23 years old, I made a mistake in marrying the wrong person who was extremely violent. And I escaped this marriage, and I was one of the fortunate ones, right? Because my parents were living in the town where I lived. I go to their apartment, I have a safe place to be. They're loaning me the money for a divorce lawyer, for counseling. I'm getting the kinds of resources that so many women in my situation don't get. And what happens after I've been there a few weeks, I suddenly realize, I might be pregnant. I might be pregnant. It turns out I wasn't. Stress can do things to a young woman's body. But had I been pregnant, there was no question in my mind that if I were to carry that pregnancy to term, what would happen to the father of that baby? He would have access to me for the rest of my life. And I knew at 23 years old that I didn't deserve that. Maybe I had made a mistake or two in my life, but I certainly didn't deserve that. Right? But the Hyde Amendment says to people exactly like me, people who were in that situation, made a couple of mistakes, down on your luck, don't have any money, don't have any resources. And by the way, at the time, I did not have health insurance. And you don't have those resources. And what does our government tell young women and older women in that situation, right? They say, you're the most vulnerable, but you're the ones we can kick in the teeth, and that's what we're going to do. What kind of a government does that to its people?
Ours.
Ours, yeah. That's what the Hyde Amendment does, and the Hyde Amendment was already codified into the bill that hit the House floor. And we were not happy about it at the National Organization for Women. Our friends, Lois Capps and others, insisted that it was necessary to put it into the bill so that we could, quote unquote, take abortion off the table. Oh no, what happened was the Catholic bishops, smelling blood, decided that they would get in the game, and they basically pushed through the Stupak-Pitts Amendment. Think stupid and pitiful. Stupak-Pitts. Named after Bart Stupak and Joe Pitts. Stupak is from Michigan, Joe Pitts is from Pennsylvania. And the Stupak-Pitts Amendment essentially overrules Roe versus Wade. It provides that no insurance company may cover abortion care if anyone in their plan has any kind of federal subsidy for paying a premium. Right? So small employers, small businesses, that's with 100 employees or less, they go into the exchange, they buy a plan, they get a little government subsidy for covering their employees. Bam, the entire plan is now tainted, and the insurance company is prohibited from offering insurance for abortions for anyone in that plan. This is a law, this is an amendment that overrules Roe versus Wade. We really, really need your help. We are now focused on the Senate to try to keep it out of the Senate law. We are determined to kill this health care legislation altogether.
Kill the bill!
Stupak-Pitts or anything like it passes, we will insist that President Obama veto the bill, and if the bill passes the Senate or the House, it goes to reconciliation and comes back out to both houses, we will target for defeat any legislator that votes for legislation. So next Wednesday there is a Grass Tops lobby day. We are asking the heads, people like you, everybody in this room, if you can come to Washington on Wednesday and lobby as a head of a local organization, the chapters, the affiliates, that sort of thing, come to Washington. Then on December 2nd, we are organizing a mass mobilization. And please go to www.now.org, and if you kind of look over on the right-hand side of the website, you'll see Stop Stupak, or Strip Stupak, something like that. Stop Stupak, and click on that. We're updating it all the time to give you more information about what's going on. The December 2nd, it's going to be a mass rally and lobby day.